Hi, everyone. Welcome back to today's show. Welcome back to the channel. And if this is the first time that you're popping into one of our programs, our live streams on Friday, you're very much welcome. I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. How are you? How has your week been? We have these live streams to talk about anything health related, anything around women's health, sexual and reproductive health, birth control, menstrual problems, menopause, and so on. And I like to devote the time to addressing questions I get from you, from my viewers. And I've got one such today. But because it also triggers a very important aspect of birth control, I thought it was great to just combine the two discussions. So I'm going to be sharing the question with us first, and then we're going to dive into the issues around birth control and fertility. If you're joining live, hello, how are you? Where are you joining from? What's the weather like? What are your plans for the weekend? Thank you for spending a bit of time with me today. And hopefully, I hope you get something good out of this meeting. And I hope that it helps to answer questions. If you have questions around this topic, I hope it addresses and you get value from the video. If you've got any comments or questions you want us to look at, make sure you send them in on the chat, or if you're watching on replay, pop a question into the comment section. And of course, you can use my email health information service that's available if you want to describe something a bit more intimate or discreet, and we can sort of go one-to-one. I will put the link to that in the description box below. But guys, please don't forget to like this video and subscribe to the channel. And with that said, let's just get cracking. So I'm going to, before I do that, let me say hi, Doc. Hello to John Bisling. Nice to meet you, John. Thank you for joining in. Where are you viewing from? Thanks for joining today. So what we're going to look at in a minute, I'm just going to pull up the question first, so that sets the stage for us. So hopefully you can see this. It's a long read, I know, but please bear with me. It's a long read. And like I said, this came in from one of my viewers. I'm just going to take away the tick at the bottom so you can see everything. Okay, so it's a long read, but please bear with me, okay? So this says, my daughter is 14 years. She started fine on her period first around 11 and a half years. Then at 12, she went with longer periods and close to each other. She had heavy bleeding only 3 or 4 days, but mostly long. And she runs on anemia, so she's anemic. This lady says, like me and my mom. So they've got anemia as a chronic health problem on her mom's side of the family. We don't know her hemoglobin lately, but the last blood test a few months ago was showing low ferritin, and she complains of fatigue and dizziness. And guys, if you watch the video I have on the impact, I can't remember what I called it, but it has to do with the effect or the impact of heavy menstrual bleeding on women's lifestyles. This, of course, is one of those classic ones, isn't it? So heavy bleeding leads to anemia, leads to problems like fatigue, dizziness, can potentially lead to very serious problems like heart failure. So this is not something to joke with. This is serious, and we're talking about a 14-year-old. So she goes on to say, I know it's a long read, but it's worth, please stick with me. So she says, however, a few months back, I took her to the OBGYN, and she gave her Larin 24 and iron 1/, Fe 1/20. So that's a combination birth control medicine. And she says, her father fought with me badly. He didn't want her to be on birth control pills at this age, not to affect her fertile health. Her father fought with me badly. He didn't want her to be on birth control pills at this age, so it doesn't affect her fertile health. We left her like that. And now it doesn't stop at all. That it is her bleeding. Her period does not stop at all. She's 14. Week after week, but light or very light. We only know it's her period when it turns heavy for a few days. So put yourself, please, in the mind or the mindset of this 14-year-old teenager and her family, because at 14, what are you doing? You're busy involved with school. You've got what do you call the physical activities? What do they call them now? You know, all the bits and pieces that you do in school. You've got all these things: PE, gymnastics, athletics, and every single kind of activity under the sun. And this child is bleeding every single day, even if it's light. The fact is that she's got to be prepared for a bleed every single day. So she's wearing a tampon or a pad or whatever every single day. And she doesn't get a break because when her proper period comes, she then continues bleeding, but it's heavier. I can't imagine. This is just this is painful. This is really painful. And so mom finishes by saying she's a hard worker at school. She's so smart. This is a problem that is threatening her education and career. What can we do? Please advise. Is it okay to take that Laren hidden from her dad? Or is there any other option solution you could suggest? Guys, please weigh in if you know what do you think. This is an interesting question. Should the doctor's giving her a birth control pill? And let's not forget, actually, I should explain. Birth control pills can be used for people who have just started their periods at the beginning of their menstrual cycles. They're commonly used to try and regulate the bleeding because most often, and I have to say it, most often, the reason for the troublesome bleeding, the irregular bleeding and heavy bleeding may simply be the hormones haven't settled down. That's most often because you're less likely to find those other causes like fibroids and endometriosis and so on in people of this age, 11, 12, 13, 14. But less likely doesn't mean impossible. And I am worried actually about a child of 14 who's having this degree of bleeding, and we've put her on the birth control pill and we haven't tried to look at what's causing it. And I think a little bit more needs to be done. And I would love to hear your thoughts. So if you're watching or you're watching this on replay, please weigh in. Let me know what you think, if you've heard or had a similar experience, and we can take that from there. So we're going to talk about this in a little while. We're going to talk about this, but we're also going to first tackle the issue of fertile health, which the dad raised. And I like the fact that dad weighed in on this because this is not just mom's problem or the little girls, the young girl. Say little? Yeah, she's little, isn't she? It's not just the 14-year-old problem, it's a family problem. So we're going to sort of look at, I think it's important to look at some different birth control methods and what actually is the effect on fertility. I'm not going to go too hard and heavy. I'm just going to give a few statements and then we can sort of come back and finish up with the questions. Okay, so just to look at a few comments. I've got John. Oh, I think I put the first one. John, I can look at some of these questions. I may not be able to address them in full for many reasons, because on YouTube, you can't get as much information as you'd like. And so there has to be a back and forth that is not possible on YouTube. Plus, we may have issues with confidentiality. So there's a limit to which we're going to answer specific questions. But I read that you're from Philadelphia, so nice. I think, is that right? In from Phil's? Is that Philadelphia? Is that the Philippines? I don't know, but let me know. Let's see. You said, I wonder why my period does not come out until now. Have I missed something? Let's see, maybe I've missed something. It says, even after my Depo expired last September, last September, so that's what, 2 weeks ago, then my husband never had sex until now because I'm worried about my period. On this, I don't understand. John, clarify this question for me. So I don't know. Do you mean that you stopped taking your Depo 13th of September, which is 17 days ago, and you're wondering why your period still hasn't come? Okay. So it's possible, if I've got that right, if I've got you correctly, if you've stopped taking the Depo 2 weeks ago, the hormone is still in your system. Okay, so it's important to realize that. So I'm not shocked at all that you haven't seen your period. And the other thing to remember with the Depo in particular is, and we're going to talk about this. So that's, I'm happy to, look at this question. One of the things about the Depo is that there can be a very long time from the time you stop taking it, from the time of your last injection till your period comes. That is a feature of the Depo. It contains that much progesterone injection hormone inside the injection. And it's good for us to be aware before we start this method, so that if we're planning to have children at some point, we already know that if we're thinking about having a child and we're using the Depo, stopping it might be planning 6 to 12 months in advance of when you want to start having the child, because Depo can delay your period and your fertility return that long. That is simply the nature of the Depo. There's nothing wrong with you, but that's the nature of the Depo. And of course, I would also check other things, because I do not like to give just one consideration or option when we don't know your medical background. It's not right, because there may be other things that we haven't considered. It's not fair. So I would say, for example, if somebody had missed a Depo shot a few weeks back, could they be pregnant? Could there be something else that's causing the period not to be present? Okay, so we wouldn't just focus on side effects of the Depo. So I would really suggest, John, if this, I don't know if this clears this up a little bit for you, let me know if it doesn't, and I will try and clarify. But I think it's useful to get all the details. But if it's simply that you're worried that it's been 2 weeks since you had your injection, your period hasn't come back, that's not unusual. It varies when the period returns from one woman to another, but that's not unusual. We can't tell you when exactly it will come back. We just know that with Depo shot in particular, it can take a bit longer compared to the other methods. Okay, so if you're watching, guys, thank you for joining the stream. I appreciate you spending some time with me today. We're just going to move straight on. So we've gone through this question. I'll just put it back on. So you've got a few seconds just to quickly go through it. You've gone through this question, which was really interesting. Somebody has sent in this question wanting advice about her 14-year-old who's got really heavy periods. She's also quite symptomatic of anemia. And apart from the bothersomeness, is that a word? Apart from the bothersome experience of having bleeding every day and how troublesome and just how just of a blare this is causing to this child, there's also the fact that it's affecting her health and affecting her studies. So this is what we're going to discuss, and we'll look at some of the issues towards the end. But let's start with birth control methods and fertility. And the first one I've got up here is the copper coil. IUC here means the intrauterine coil. And it could be the copper coil or the progesterone hormone coil. So whichever coil, I just put them together in this shot. Okay, so this statement is a statement of fact. These details are from the Faculty of Sexual and Reproductive Health in the United Kingdom. If you want a reference, you can access their guidelines online, and I will put a link in the description for all the different links for all the different resources I've used, but this is where this is sourced from. So this statement is that using the coil does not make you more likely to have an ectopic pregnancy. Now, the reason I brought this up specifically is using the coil, whether it's the copper or the progesterone coil, does not delay your fertility, does not affect your fertility long term. While you're on the method, of course, both methods work by preventing ovulation. They have different mechanisms for doing that, but that's essentially what happens. And when you come off them, when you stop taking them, your fertility returns. Might take some time, and it does vary from woman to woman, but it is not delayed like the Depo shot, which I've just been talking about. So you can find that you take out the coil today, and within the next couple of weeks, you're fertile. Within the next potential of falling pregnant within the next month of taking the coil out is there. You take it out. That's for example, the copper coil. You take it out, and if you're not careful, if you don't take something to replace it, especially if you're not ready, you run the chance of falling pregnant and having an unscheduled pregnancy. So there's got to be a plan. It's fine if you take it out and you want to start your family, that's fine. So the copper coil, the Mirena coil, the JDS, and all the other progesterone hormone coils share that similarity. The reason I put up ectopic pregnancy here is because somebody may say, well, oh, I've heard that the coil makes you could make you have an ectopic pregnancy. An ectopic pregnancy is a pregnancy that develops outside of the womb. So most commonly, what you find is that the pregnancy develops in the tube, fallopian tube. Now, in the first instance, having a copper coil reduces your chances of being pregnant in the first instance. It is so effective that if you've got the coil, you're not likely to be pregnant in the first instance. So when we're talking about does the coil cause ectopic pregnancy, or does it make me more likely to have an ectopic pregnancy? The first thing to understand is that because the coil, whether it's copper or progesterone, does such a great job, over 99% effective in preventing pregnancy, it reduces the overall possibility that you are going to get an ectopic. I don't know if I make that clear, because it's really good to understand and not be confused by some of the gists or some of the stories you might see out there. It's good to always have clarity. However, and this is important to say, if there was that less than 1% chance that you fall pregnant while you've got the coil, then it is possible that that pregnancy could be situated in the tube. So if there is that small chance that you fall pregnant, and it's less than 1% because the coil is more than 99% effective, that pregnancy could locate. There's a greater chance of that pregnancy locating in the tube than if you didn't have the coil. Because think about it, the coil is sitting in the body of the womb. I'm sorry, I didn't put any pictures up to show you, but the coil is sitting in the body of the womb. So if the coil's pregnancy prevention feature failed and pregnancy managed to happen, and the pregnancy is moving into the womb to implant, and the coil's there, so it can't do that comfortably, the pregnancy could take up root in the outside the womb in the tube. And that's where the story about coils and ectopic. Now, having an ectopic pregnancy, in terms of the treatment, the potential of losing the tube is there, because sometimes you need surgery to remove the tube. Sometimes a woman might be left with a tube. I have a lot of information and resources about ectopic pregnancy on our website, AskAwayHealth.org. If you wanted to learn, please go and check those out. But the thing is, of course, that could affect fertility, future fertility, because if a woman has a damaged tube or has just a single tube following an ectopic pregnancy, you could say that there are issues with her fertility, and you could link that to having the coil. So it's important to bear this in mind, that majority of women who have the coil do not have any problems, because its presence means that they are so unlikely to fall pregnant compared to women who don't have the coil. It's not an issue. The fact is that, however, in a very small percentage of cases, if pregnancy does happen, then yes, it could potentially happen in the tube, and that's how an ectopic pregnancy develops. Okay, so that is the first one. That is the first one, and I'm just going to, so let's move off this, and I'm just going to pop back into the comments. So let's get rid of this one. Here we go. Okay, so let's have a quick look. I think a couple of comments came in, and I will try and take comments as we go through the video. I know sometimes questions might be unrelated to the topic, and I'll try. And again, if there's something that needs very specific information, please forgive me if I do not respond specifically. Again, because it's useful to have as much information as possible, and it's not, that can happen on this kind of forum. Hello, doctor. Can a person be pregnant on Depo? Yes, because Depo, even though it's a very effective form of contraception, is not 100% guaranteed to prevent pregnancy. So there are such things. Even I was just talking about the coil, and we said, oh, more than 99%, and Depo more than 90% effective, and none of these methods are 100%. None of them. None of them. Abstinence is the only method that is 100% effective, not having sexual intercourse. So is it possible to get pregnant on the Depo? Yes, it's possible. If you've taken the injection exactly as you should, every 12 weeks or every 8 weeks or whatever schedule it is, depending on your drug or your injection, there is still a small chance of failure of the hormone. That even increases if there are problems like delays between injections. So, you're maybe more than a couple of weeks after the due date for your next injection. That breaks contraceptive, that breaks the contraceptive effectiveness of the method if you delay longer than you should with taking it. So it is possible. But that's why women are encouraged to, stick to, as much as you can, stick to your planned, your scheduled next Depo shot. If you have a break, or if you fail to attend at the right time for the next shot, make sure your provider is aware. They might want to do pregnancy tests, or if you've had intercourse during that break period, you should take emergency contraceptive pill. Everything possible to try and prevent you from falling pregnant, without planning, without being ready for it. But it's important to know that yes, none of these methods is 100% effective. So it is possible that you might experience contraceptive, you might fall pregnant while on the Depo. So, like, I'm just going to go to the very next method that we have. So we've talked about the coil, and now we're going to talk about the emergency contraceptive. So emergency contraception, oh, no, not that one. We've talked about the coil, haven't we? Yes. Okay, so we're talking about the emergency contraceptive. Okay, so this is the pill. Why does it keep switching on to here? I wonder. I'm not sure what's going on. Hang on, let's see. Okay. Let's see if it stays or switches. Yeah, it is switching. Oh, I think I know what's happened. Okay, let me just take this one out. I think I know what's happened. Okay, so let's see. Birth control implant, not that one. Okay, let's stick with this. I think this would work. Let's see what happens. Okay, so I want to talk about the emergency contraceptive pill. So, if you watch the channel, I talk lots and lots and lots about the emergency contraceptive pill, the one containing progesterone or the one that contains ulipristal acetate. Please go and have a look at my videos if you're wanting clarification or to understand better how they work, or you want to know, things about the side effects of the pill and so on. Please go and check out. I've got so many playlists on these topics. Now, the studies tell us there is no long-term effect of taking the Postinor, levonorgestrel, Levonel, Take Action, Plan B, Post Pill. It's got so many different names, Ella. None of these methods affect a woman's long-term fertility. Whether she takes one tablet once in a while, or once a couple of times a month, or 3 times a month, or whatever, there is no evidence that it affects a woman's fertility. Okay, so it's important. This is for emergency contraceptive pills. So we have no evidence. They're fine to take in terms of not affecting your fertility. Do they have side effects? Yes, some women have side effects with some of them. Some women can't tolerate them very well. So some women may have problems like tummy upset. They might experience vomiting. But generally, they're quite well tolerated by majority of women. The thing that troubles women the most, I think, is when it comes to issues around the period and the delay in the period or the change to the cycle after taking the method, after using the pill. That concerns women a lot, and I get so many questions around this particular area because women are worried about, well, when is my period going to come back? I took the pill 2 weeks ago. I took the pill last month. When is my period going to come back? We can't predict when your period will return, but that doesn't mean that the pill affects your fertility. There could be some delay because of the effect of this hormone on your cycle, but it does not long-term delay fertility. You could fall pregnant, so you need to be vigilant. You need to be careful. We can't tell you after taking the pill that, well, your period will come back in 2 weeks or 3 weeks. We can just estimate and say, well, if you've had the pill, this might happen to your period. It might come a bit early. It might come a bit late. It might come at the same time. So these are just the options that we have, but it does not affect long-term fertility. So that's with regard to the emergency contraceptive pill. Okay, so we've done the pill, we've done the coil. What's the next one? The implant. So the implant is a long-term birth control method. Goes into the upper arm, and it is, because it contains progesterone again, and it's long term, it's also one of those very effective methods, again above 90% in terms of being effectiveness. In terms of being effective, again, there's no evidence that this method affects fertility. Okay, there is no evidence that being on the implant or using the implant can affect your fertility, especially if you use it for the recommended period of time when it's supposed to be in your arm. Now, it is also very important to stress to women that your fertility could return very quickly as soon as the implant is taken out. So it's also when it's been taken out. So if you've got the implant and you're going to your meeting with your practitioner and it's time to have the implant, what they will tell you, if you've not made up your mind on another method, or you don't want to use another implant, or whatever the scenario is, you'll be cautioned and advised about either using a condom, because you could fall pregnant quite quickly after the implant is taken out, because the hormone effect will begin to quickly work its way out of your system. So this is not one of those methods that's going to impair fertility, and it's really important that we are aware of this in terms of the differences between the methods. But the implant is, of course, quite effective. It removes any form of decision making. You don't have to worry about remembering to take it like the pill, or to insert it like the ring, or apply it like the patch, or have an injection every few months and so on. So it's got its benefits. The other thing is about troublesome side effects. And again, I've got a very good video which I published recently on the best birth control methods for women with heavy bleeding. I think that's the most recent where I remember talking about this. So please go and have a look at that if this is something you're interested in knowing differences in terms of how these methods affect our menstrual patterns. So we've talked about the emergency pill, we've talked about the coil, and we've just talked about the implant. So now let's look at the next one. So this is the regular pill. This is the regular pill. So this is either the combined pill, that's combined hormones. So you have both progesterone and estrogen, or the mini pill, that's the progesterone only pill, or, and I've put these sort of icons at the top to remind us that in the combined pill, the combined method also has a couple of alternative options. You can have it as a ring, or you could have it as a patch. They contain the same hormones in any of these methods. But the bottom line is, with the progesterone pill, the combined pill, or the patch, or the ring, that, whichever, no evidence that using the pill is associated with a subsequent long-term reduction in fertility. This is directly related to our scenario that my viewer shared with us, that we read out in the beginning, because the concern is about this contraceptive method that the doctor, the specialist, has given to this child, or this young lady, to manage her bleeding. And the dad says, no way, this is going to affect her fertile health in future. So the question is he right? Is he right to be worried? Well, according to the evidence, and remember, I'm getting this resource from the Faculty of Sexual and Reproductive Health in the United Kingdom, also based on several pieces of research work. And like I promised, I will put the link for you in the description box so that you can also check this out yourself. There is no evidence that a woman who is on the pill, when she stops taking it, will have trouble falling pregnant. Okay, there is no evidence. But, and in fact, women ovulate so that their ovaries start releasing mature eggs within a month, 6 weeks less of stopping these methods. Okay, so within a month. And remember, for those of you who use the pill, or any of these methods, remember how we tell you, if you miss one day, if you miss one day of your pill, if you've had intercourse, go and take an emergency contraceptive method. If you miss 2, if you miss 3, everybody, the alarm bells are ringing, because it's so easy to break your contraceptive protection. So if it's so easy to break contraceptive protection when you only take it, when you only miss it for 2 or 3 days, where is the worry that it can potentially affect long-term fertility coming from? So there's this bit of misinformation that's important to address, that we haven't got any evidence women are able to fall pregnant when they stop taking their pill. But I will say this here, and I'm also going to repeat it in another method. Some girls and some ladies will stay on the pill for 8 years, 10 years. They're happy with the method. It does the job. It does what they want. It does exactly what it says on the tin. It suits them. They're used to, setting the time. They know when they take the pill, maybe first thing in the morning, last thing at night. It suits them. They don't have any troublesome side effects, and so on and so forth. And they might stay on this method for years. And your doctor, your health provider is happy, because when you go for your checks, your blood pressure is fine. You've not put on any weight. You're not smoking. You don't have any of those risk factors. And okay, hey, fine. And then perhaps somebody started it at 25, or, mid-20s or whatever. And then they stay on it for 10, 11 years. It does happen. Get to 36 and then comes off the pill, and perhaps has trouble getting pregnant. And so it makes sense. It's easy to say, oh, well, it's because you used the pill that long. Well, actually, that may not be the case. I'm not saying with any absoluteness or anything like that. But the other thing I want you to weigh in is the fact that as we grow older, fertility will decline. fertility will decline, and that has nothing to do with the pill. The same way fertility declines in a woman who is age 35 and older, who never used the pill, is the same way fertility is declining in the woman who's 35 and older, who has been using the pill for 10 years. I don't know if that makes sense. I don't know if that sort of helps to. It's important to have that in the back of our heads, because as ladies, we're born with all the eggs that we've got. Okay. So as we grow older, our eggs are growing older. Our eggs are growing older as we age. So the quality of eggs at age 20 is different from the quality of eggs at age 35. It's important to bear that in mind, because it may not necessarily be the method that's causing the problem, but simply an advance of age, a natural advance, that as we grow older, so our eggs also grow older. I thought it was good to chip that in, and I will mention it again in another method. So we just talked about that one. Let's move on to the next one. We've done 4, haven't we? We've done the emergency contraceptive, we've done the pill, the combined pill, the mini pill, we've done the combined, the patch and the ring, which contain the combined hormones. We've done the coil, haven't we? Yeah, okay, fine. So let's see what the next one is, the birth control shot. Okay, so that's a nice lead in to the birth control shot, because I'm going to say pretty much the same thing. Now, this is the one. And if you're joining the stream live, hi, I'm sorry, I'm not looking at the chat a lot, but welcome if you're coming in. We're talking about the effect of infertility, of fertility and birth control, fertility or infertility, whichever you want to refer to it. We're trying to explore this to see, is there truth? What is the fact behind birth control methods and the effect on a woman's long-term fertility? That's what we're exploring here. And I'm just putting forward some statements gathered from the Faculty of Sexual and Reproductive Health in the UK, and just sharing them and seeing how we can manage these beliefs that we have. Okay, so we've done a few now, we've done 4, we're now on the 5th, and we're talking about the birth control shot. Now, the truth about the birth control shot, again, it's a long-acting method, but it's reversible, because you can stop it and your fertility will return. But the truth is that the fertility return can be delayed for several months, up to a year, sometimes even longer. That's the truth about this particular method. And again, if it's a method that you're happy with, if it's a method that you're comfortable with, and you don't want to change it, and your doctor or your nurse is happy because your weight's okay, your blood pressure's okay, you've not developed any conditions while you were on the method that could make us a bit worried about, you being on the method, and so on, then you could potentially stay on this method for quite a long time. And what if you then decide to come off this method, and then you're like the lady who asked us at the beginning, who talked about she stopped the pill 2.5 weeks ago, and she's worried, not the pill, sorry, she stopped the shot. She stopped the Depo shot 2.5 weeks ago, and she's worried that she hasn't seen her period. And I was saying to her that, well, the nature of the shot is that when you stop taking it, your period may not immediately return. For some women, it might do, but for many, it may not immediately return. That is the nature of this method. And if you're planning that, okay, I want to be on the shot, and then maybe in next 16 months or next couple of years, then let's start our family, then you should factor that possible delay into your plans. And be saying to yourself, okay, since we're going to start a family in about two years, or in about 18 months, perhaps switch to a method where you will have quicker return of your fertility. So allow the Depo to wear itself out of your system, but you're on a method, because you're still not ready, but you're on a method that allows your fertility to return. So, or that quickly allows your fertility to return. So we're talking about the Depo shot here, and we're talking about the fact that it can take up to 12 months or longer for that fertility to return. And again, I'm going to remind you very quickly that as you age, your egg quality declines. And so that may be what a woman who has been on the Depo for a few years, maybe 5 or 6 years, she might have started in her 30s, or, whichever, comes to the point where she now wants to start having kids, and is struggling and we're blaming the Depo. Well, the thing is, the nature of the Depo is that your fertility will come back. That the hormone effect is not going to be in your system forever, and it doesn't cause permanent changes. And please don't get me wrong, because not every method suits every woman. There's some women, I always say to people and say to my clients that you can put people in two categories who are using these methods. There's a category who absolutely love the method. It works for them. It's fantastic. And for the same method, there's another category who hate it, who say it's horrible and so many different things about the method. So it's not the same. We don't all have the same experiences. And I take that on board. What we're looking at is this is the effect of the hormone. So it's about making that decision as well. If it's something that you don't think you can manage, then it's best to leave it alone in the first instance. But this is what the Depo shot does. And if you stop it, if you've been on the Depo for, since you were 33, and then you decide you're ready at 37, to start trying for a baby, and you find that it's difficult, well, I will say not only will the Depo shots, not only will stopping it at age 37, you might still have to wait a few good months, but also remember that at age 37, your egg quality is not the same as what it was when you were 27. And it's just something that we should remember and be aware of. And of course, there's something to be said for ladies, if it's possible, if it's available to you, about freezing eggs. There's something to be said for that consideration, because we don't know life. You don't know when you want to settle down, and it may be that deciding to freeze eggs at age 25, 27, or when you can, because you don't know whether you might get to 40 or 42 and decide, okay, now this is the time that's good for me to start a family. Then you've got those eggs that you froze some years back that you can then use to carry out different fertility methods. So there's something to think about there if you wanted to. Okay, so I think we're nearly done looking at the methods. I'm just going to quickly go into the chat because I think there was a question that I had missed. I'm just going to try and look at that, see. Okay, so this is from Wallace Sterling. Hi Wallace, thank you for joining. It says, I'm 46, I'm in premenopause, I have fibroids, I have 2 days heavy bleeding. Can I take the pill? I have no pain, and I have 6 days period, no spotting. I have 2 days heavy bleeding. Can I take the pill? She's 46. So in terms of taking, of course, these are looking at abstracts, because we don't know everything about this lady and what makes it suitable, what makes the pill suitable for her. There's nothing against her trying the pill if she doesn't have any other risk factors that might make the pill itself unsuitable for her. Don't forget, it's a hormone that contains a combination of estrogen. I presume she's talking about the combined pill, estrogen and progesterone. So she's saying she has 6 days period, no spotting. And so she's looking for a method. So this is worth discussing, looking for a method that can help to lighten the period. There is nothing, as long as it's suitable, you can use this method to reduce the heaviness of the bleed and give you some relief from struggling with very heavy periods, if it is suitable. I don't know. I don't have enough information about your medical background to say yes or no, but it's worth discussing as an option to see whether it's suitable. The fact that she's 46 doesn't immediately knock her out of the running for being on the pill. But don't forget that being older, you have higher risks of health problems, including strokes and heart attacks that the pill increases the risk for as well. And this is why, for example, if you smoked or if you were overweight, then we would not be recommending this method, that the pill as a method. And so that's why I'm saying, I don't know. It's worth discussing, and that discussion with your provider, then you can talk about your specific circumstances, and that is what helps to make the decision. So thanks for that question. Thanks for giving us opportunity to sort of think around it. Wallace, I hope that was helpful, and I would encourage you to discuss further with your provider to make sure it is suitable for you. So where were we? I think we just have one or two more. We've done the Depo shot. We just finished with that. I think we just have good. So I think we've talked about the major methods, and we've looked at fertility. And the conclusion really, and I'm sure you'll agree with me, is that apart from the Depo shot, none of them has any long-lasting effect on fertility. And even the Depo shot has just a longer effect on fertility. This is well recognized, is documented, is not new. What the challenge, I think, is just being aware as the lady using the method and planning, using that information to plan what you want to do, so that you're not worried, you're not unhappy, you're not shocked when, oh, I just stopped the Depo, why hasn't my period come back? You're aware. So I just quickly wanted to go through a few other methods. Sterilization, if you decide to have a sterilization, well, of course, your fertility is affected. So, that's that. It is just one of the methods, male and female sterilization. Of course, it will affect fertility. Condoms do not affect fertility. The withdrawal method does not affect fertility. Fertility awareness, using a calendar to check your fertile days and having intercourse outside of those fertile days does not affect your fertility. Lactational amenorrhea method, which is the LAM at the bottom, also does not affect your fertility. This is when a lady decides to use the fact that she's within 6 months of breastfeeding and she's breastfeeding constantly. She's on demand breastfeeding. So I think less than she breastfeeds or expresses her milk every 3 to 4 hours. Make sure that she continues to trigger the hormone every 3 to 4 hours to make sure that method is effective, and only up to 6 months. So these are some of the methods. I can't think which ones I've left out, but these are some of the methods. So that brings us nicely back to what brought us into this in the first place. And if you're watching, if you're here, I would love to know what you think. Just get a drink. Yeah, it would be great to know what you think about this scenario that we've got here. But let me share my concerns. So if you're watching in the replay or, watching live before we start to shut down and round up, I would love to know what you think. My concerns are, yes, like I said earlier, yes, we would start a young lady or young person on methods like the birth control pill in the first few months of their menstrual cycle if they're having irregular, heavy periods. That's recognized practice. It's recognized and accepted practice because we tend to, we tend to find that conditions happen within subsets or within particular age groups. And fibroids, polyps and other causes of abnormal menstrual bleeding tend not to happen so frequently or often in young people. Excuse me. So with that said, that's why this method of, if you come in with your daughter, or if your teenager who's 14 or 15 comes into the clinic and has heavy bleeding, she started her periods and all of a sudden they're getting heavier, or they've been gradually getting heavier, more painful and so on, there may not be any tests carried out. And the decision is, well, let's start you on the pill and see if that helps. My feeling about this is, if you take that decision, the important thing is to make sure that you are checking on what happens in the next 6 weeks, 8 weeks. See what happens. Is it helping? Is it making things worse? Some women complain that, oh, they just stuck me on the pill for 5 years or for 10 years, and I didn't realize I had fibroids, or I didn't realize I had polycystic ovary syndrome until I came off the pill in my 20s or 30s and I was struggling to have a baby. So there is that concern. You also want to question, well, at what stage can you actually start doing these tests on young people? For example, scans, you do blood tests because you're trying to find out, well, she's got very heavy bleeding, it's abnormal, what's causing it? And then you'd have to do things like blood tests and scans. You might even have to do camera tests that look into the womb, some things that are a bit invasive. How do you do those in a young person? I think these invite individual discussions, but I'm worried about this because this is a lot of bleeding. We read it out at the beginning. Initially, she had heavy bleeding, just 3 to 4 days, but she had heavy bleeding. That was how it started. but she was also getting anemic, and that was affecting her. It wasn't just it wasn't just the random, I don't want to say right, that's not fair, but it wasn't mild anemia. That's a better way to describe it. This was the kind of moderate to severe anemia that she was already developing. She's being tired, she's dizzy, she's not well. So I think it's important at this point not to assume that this is just hormone imbalance that's arising because this is a young woman who's just starting her reproductive journey. I think we should be interested in finding out, seeing what else we can do to find out more, perhaps some blood tests and a scan. So this is something that should be discussed with the doctor, and maybe it was, I don't know, we don't have that information, but these are the things I will be interested in. Now, the next bit of clarification and issue is why we spent over half an hour looking at the birth control and fertility issues was because the father comes into the picture and he hears that a contraceptive method, and this is a method that is generally accepted and recognized for treating heavy bleeding problems similar to this, but he refuses and says, no, she's not having it. It's going to affect her when she wants to have a kid in the future. It's not going to happen because of this method. And we said, well, was he justified? I think he's, as a parent, of course, he's justified in wanting to be clear about his daughter's health. And I think there was an opportunity for education and for the doctor to pull out the bits of information, as I've done here, to demonstrate, well, these are the facts, these are the studies, this is what it is. Whether that will change his mind, we don't know. But there is enough evidence, I believe, to say that no, putting her on the birth control pill will not likely affect long-term fertility. The biggest concern that we have here is that this is quite a lot of bleeding because it's taken over her life. We hear now that she's having daily bleeding. They say it's light. Okay, they say it's light, but after some time, she then has very heavy flow, which is when it's the proper period. So why is she bleeding in between? What was going on? I'll just take this off so that I'll just take this off. So what's going on in the meantime? Why is she having? So there's a few questions that we should be looking at in terms of responding to the question. I would think that there's enough. If it was that, okay, let me give you a scenario. If it was that this was a mom and her 14 or 13-year-old who came and said, oh, do you know what? Since she started her periods, it's just been a nightmare. She has a bleed this month and then nothing the next month, or she gets spotting and then the next month it's heavy. So it's not everywhere, here, there, and everywhere. It's just, if that were the picture, and then mom might say, I had the same thing as well when I was younger. It took a while before mine settled down, and my mom had the same. You could sort of see there's a pattern, and then you check out this young lady, nothing else going on, no other symptoms. You examine her tummy, you can't really feel anything. She seems well. It's reasonable to say, without doing tests, to say, right, should we try the combined pill, which would help to regulate your period and see what happens? And it's usually just to calm the periods down, and it might be for a period of 3 months. It might be for a duration of 3 months or 6 months, and then the period resets itself. Or I think that's the best way to put it. By that time, or during that time, her hormone pattern, her natural pattern, is allowed to settle, allowed to establish itself, and she finds that when she comes off that method, her natural pattern has calmed down, and she has regular bleeding that she can tolerate. Some girls might decide that they want to continue using the pill, not just for regular, controlling her bleed, but because she now wants a contraceptive method. That's another discussion altogether. But I'm not an advocate of leaving them, or leaving someone on the pill for endless weeks, months, and years without sort of reviewing things and checking that the bleeding is not getting worse, checking that there's nothing else that's going on, which is my concern here with this scenario that we're given. So yeah, in terms of responding, in terms of advising what the next thing to do, would you say she should go behind the dad's back to give the pill? I think, I think it's I wouldn't recommend. It's not my decision to make, is it? It's not I can't tell you, but it's not very good. I would really prefer that dad came into the room with everybody else, with the mom and with the young lady herself, and we had a proper discussion about this. explored what are the facts and what are the misconceptions, and then look at, have we done everything that we can do? Are we satisfied that we know what's responsible? And then if we choose to use the pill, how long are we going to be doing this for? So there's lots of things to talk about in this kind of scenario. And like I said, and I keep saying, I would love to hear your feedback if you've had a similar experience or know somebody who's had something like this before. Please share with us in the comment section. So guys, thank you so much for joining me today. We've come to the end of the show. Thank you so much for everybody who joined in, who sent in a question and who made a comment. And if you're watching in the replay, thank you as well. I really appreciate your time. Guys, don't forget that we have the Ask Away Health Community Forum. On this forum, you can join a community where we share experiences. You know, I'm going to put this, you know, this up on the forum and see if I can get people to also contribute and see what they think. But you can also do that yourself. You can join the forum and put up your own questions or share experiences so that we can learn. It's a safe space where we're interested in fact-based information, health information to support us to live better. So thank you so much for being here today, guys. I hope you have a lovely weekend, and I will see you again next time. Don't forget to have a look at the latest videos published on the channel. We've got a few things on green tea and fibroids. We've got something about is it normal to bleed after taking the morning after pill or something like that, around that kind of topic. Well, we've got so many different things that we're talking about, looking at as it affects women's health. And this video in particular is dedicated to World Contraception Day, which was on just a few days ago on the 26th. So World Contraception Day 2022. Because these are matters that are here with us that we have to address and answer. So I hope you found it useful. If you're watching this live or on the replay, thank you again for joining me. Have a great weekend. Bye-bye.